again, everyone. This is Molly with Phoenix Children's Hospital. Today we are talking with Dr. Robin Blitz, Director of Developmental Peds at Barrow at Phoenix Children's Hospital. We're talking about autism today. Please remember that if you have any comments, to put them into the actual comments, and we'll be sure to ask them. So Dr. Blitz, thank you so much for joining us. To start, can you just give us a definition of autism and what it includes?
Sure. Autism is a social impairment. It's a disability that involves impairment in social skills, communication skills, and has repetitive, restrictive behaviors, interests, and activities. So the person with autism has difficulty communicating, understanding social cues, understanding what other people might be thinking and how to respond in different situations, and also has repetitive motor movements or language or interests.
So how many different kinds of autism spectrum disorders exist? I know that there's Asperger's. What other things?
So in 2013, actually, the Diagnostic and Statistical Manual came out, the 5th edition, and actually clumped all of the different autism spectrum disorders under one autism spectrum disorder. So there's Asperger disorder really doesn't necessarily exist, though I know there are people who were previously diagnosed with Asperger that objected to that. So we talk about people with autism spectrum disorder, or ASD, as having a range of abilities. Intellectual disabilities, communication abilities, social abilities, and so really kind of understanding that a person with autism spectrum disorder is a person, oops, sorry, the door just opened, may have intellectual disability or may have above average, superior, or genius intelligence. A person with autism may be nonverbal or may have great vocabulary and be hyperverbal or only interested in talking about their area of interest. A person with autism may not have friends and not care at all, or a person with autism may recognize that they don't have friends but are interested in figuring out how to have friends and how to have that social network. So it's a range of abilities.
Does it vary from individual to individual?
Yes, of course. People in the field, all of us say if you've met one person with autism, you've met one person with autism. Like we all are different, right? We all have our differences, we all have our strengths, we all have our weaknesses, and so the disorder of autism spectrum disorder should never define the person, of course.
And talk about that, because you talk a lot about the sort of the language to use when you're talking to or about someone with autism. How important is it to not let that define them?
So to or about someone with anything, right? We talk about people first language, because that means that everybody is a person first, and just because they have a medical disease or disorder doesn't define who that person is. So we should be respectful of people, we should be respectful of our patients, our children, with different diseases and disorders, and so when we're referring to a child with diabetes, this is not the diabetic. When we're referring to a child with Down syndrome, this is not the Downs kid. When we're referring to a person with autism, this is not the autistic, So I think it's very important that we remember to always use people first language, and because I wouldn't want to be defined by the fact that I have scoliosis, I wouldn't want to be defined by the fact that I have some arthritis in my hands. It's not who I am. It's just things that make sometimes different situations difficult.
Interesting. So going back to autism a little bit, what are the symptoms that you might see? I know you mentioned a few, but...
Right, so when parents come to me with their children, when I'm referred patients, it's most commonly because a child has speech and language delays. They didn't start talking on time, or they were talking and then lost their some of their vocabulary or all of their vocabulary, and regressed in social skills. So about 25% of kids with autism have the regressive form of autism. which we still don't completely understand. There are many researchers and scientists in the field who feel that probably in the next 5 or 10 years we'll be talking about all of the different genetic abnormalities that can cause autism, and we'll understand that there are multiple autisms. There's this group that has the regressive form of autism. There's this group that has intellectual disability with their autism. There's this group that has what we might call high-functioning autism, where their intelligence is average or above average and they're verbal. So we already know that things like Fragile X syndrome in boys causes intellectual disability, and many of them have autism as well. So, but to go back to your question, what are the symptoms? Most people come to us because of speech and language delay. Sometimes it's because of being kicked out of multiple daycares because of disruptive behaviors like self-injurious behaviors, aggressive behaviors, hyperactivity, which sometimes is due to sensory overload, the sensory hypersensitivities. My child really fights me on toothbrushing, hair cutting, hair washing, tags in their shirt, putting lotion on, screams when I turn on the vacuum or blender or hair dryer or public toilets flushing. So those are some of the signs and symptoms that we see commonly.
Sure. So can you talk about how common autism is in Arizona, where we are, as well as across the country?
Sure. So the prevalence rate really seemed to have increased significantly over the last 15 or 20 years, but over the last 3 to 5 years, it's been very stable in the country. The prevalence is 1 in 68. In Arizona, it's 1 in 66. Certainly, we know that about 4 to 5 times more boys are diagnosed with autism than girls. We certainly know that there are abnormalities on the X chromosome, like Fragile X syndrome, that cause autism. And since boys have 1 X and girls have 2 X's, we find it more commonly in boys. That prevalence rate means there's probably about 1.5 million people in this country living with an autism spectrum disorder. So it's one of the most prevalent disabilities that we have, and people are getting older. And so we know now that we, in the state of Arizona, we're working on, what are we doing for our young adults and our older adults with autism spectrum disorder now. And I've had the privilege of sitting on the governor's advisory committee to help make recommendations to the governor, and we've continued to work on how can we create statewide system change to support all of our children and families with autism, children and adults, I should say, with autism as well.
Sure. So you mentioned this a little bit, but in a child who has autism, can they have other issues too that need to be addressed?
Oh, absolutely. So many people with autism, probably about 50%, have intellectual disabilities, which means that their intelligence is below normal, and that needs to be addressed as well. People with autism can have most people with autism have social impairments, and along with that, social anxiety or other anxiety disorders, have repetitive and self-stimulatory behavior. Sometimes it gets to the point of being an obsessive compulsive disorder. Older people with autism, teenagers, adults, especially people with high-functioning autism, can have depression and are at risk for suicide. And then certainly, of course, there's medical comorbidities. Many of our young kids are very picky eaters, have very selective diets, which means that the pediatrician, the family practice doc, the primary care provider really needs to understand this food selectivity and look for causes like food allergens or celiac disease or other issues, feeding disorders because of oral motor problems or swallowing problems, and then help the parents address the nutritional deficiencies that may be there. I had one patient who all she would eat was Lorna Doone cookies and milk. So not only was she deficient in iron, and because of all of the calcium competing with iron absorption and not taking iron-rich foods, she was deficient in she wasn't eating any fruits or vegetables, so a lot of her vitamins, and she was really constipated. So sometimes the food selectivity in and of itself causes constipation. We also need to think about sleep problems. 80% of kids with ASD have sleep problems, and if they're not sleeping, it affects their learning, attention, and behavior during the day. It also affects the parents and the whole family, because then the parents aren't sleeping because they need to keep their child safe. So it's a whole family function problem, especially when the child's not sleeping.
Sure.
Or when children are flight risks, they're running out the door. And if people are in apartments, it makes it very hard. We have to write special letters to convince their landlords to let them put special locks on the doors.
Oh, wow. That's interesting.
Mm-hmm.
So it's basically the start of a lot of different things to think about when a child is diagnosed with autism.
Absolutely.
And that might be overwhelming for parents. Do you have any advice that you would say for a parent of a child who was just diagnosed?
Well, so one of the things that we give to all of our parents is our Emily Center, which is our family resource library, which is one of Phoenix Children's gems. And they are open 7 days a week. They have nurses there to help parents research things, and they've put packets together for us on resources and information for people newly diagnosed with autism. And included in that, we have a packet on the 100-day toolkit from Autism Speaks, which is a national organizational national website. And the 100-day toolkit helps guide families through, okay, your child's been diagnosed with autism, this is what you need to do for the first 100 days. And so not only what to do for your child to get that appropriate intervention and health care, etc., but also what to do for you as a parent and what to do for you as a family. And that includes the parents need to sleep, and the parents need to develop support, and the parents need, if there's two parents in the family, they need to talk to each other, and they need to make time for themselves, because what can happen is you get so overwhelmed and absorbed in your child's diagnosis that you forget about taking care of yourself and taking care of the rest of your family and your significant other. And we want to help build those relationships, because you need each other to support. And that's not just with autism, that's a new diagnosis of diabetes, that's a new diagnosis of leukemia. So
yeah, that makes a lot of sense. So do we know what causes autism in similar ASDs?
So we definitely know that and depending on who you read and who you talk to, there's probably at least 20 different chromosomal abnormalities that have a high association with autism. Of course, Fragile X syndrome we already mentioned, tuberous sclerosis, neurofibromatosis. People with Down syndrome have a much higher risk of autism. Some publications say 10%, some publications say as high as 15%. And then there are the microdeletions and microduplications that can occur on the chromosomal microarrays. So there are hotspots on different chromosomes, like the 15th chromosome and the 7th chromosome, that are associated with higher risks of autism. There's publications now that, not to put the blame on anybody, but older fathers have a higher risk of having children with autism. And people ask me, well, why is this increased prevalence rate? Well, some of it is understanding the diagnosis and understanding that it's a spectrum disorder. So children that may have just been diagnosed with intellectual disabilities 10 years ago are now being diagnosed with autism, and we understand that their nonverbal IQ is actually above average, and don't have intellectual disability. But you have to wonder, like in the last 20 years or so, 30 years, we have more divorce, we have more second families. There's evidence that the older fathers that are associated with that. We also have toxins in our environment that we didn't have 30 years ago and 50 years ago, and so there's some evidence that if a child has a genetic mutation and there's we have higher prenatal exposures, that sets off a cascade of events that may lead to autism. So There's a lot of variables. It's a miracle to me that any child is born normal or without any. When I say normal, in the broad scheme of normal, right? None of us are normal. I've told all my children when they were growing up that normal is boring because
yes, of course.
There's nobody without something,
right?
You know? But I think that there's things in our environment that can lead to increased risk of a lot of neurodevelopmental disorders. Pesticides have been linked with a higher risk of ADHD, for instance. BPA has possibly is a hormone disruptor, so it's linked to other issues that may be included. And I just found out myself probably a couple months ago that there is BPA in the lining of canned goods. I mean, we all think about BPA in plastics, right? And never heat your plastic because it can leach out the BPA, but now we're understanding that the lining that they've put in canned foods have BPA. So, I've instructed my son, well, when we're getting our canned beans, look for BPA-free lining because we don't know what that's going to cause in our future. So
being aware is key.
But it's hard because there's so much out there, and trying to understand what's true and what's not true. Because, especially like you Google autism, there are a million hits. And you can find anything can cause autism. I blinked too many times it caused autism, right? So one of the things that I really try and encourage parents to do, and why we put this packet together with the Emily Center, is these are credible websites. Autism Speaks is a credible website. I don't want to discount concerns, and I always want parents to talk to me about their concerns and about what they've heard and what new treatment and what new study, because I'm happy to research that and look that up. But there's so much information out there, it's hard to comb through all of it.
Yeah, absolutely. So we have a pretty specific question from our viewers. Is it possible for children with autism to urinate themselves when they are 6 years old and older?
So I'm guessing that means, is it possible that a child with autism might not be toilet trained yet? And that's absolutely possible. Certainly if the child has intellectual disabilities. So if a child's 6 years old but only has the cognitive ability of a 2-year-old, 2-year-olds aren't generally always potty trained, right? So we have to think about what is the child's cognitive level first. And then children might be scared of sitting on the toilet because they might be scared that the water might splash on them. I had a little boy tell me that the other day. He will urinate in the toilet because he's standing up, but he will not sit on the toilet for bowel movements because what if the water splashes on him and the water has germs and he doesn't want germs on his bottom? So we're working on that. But there also might be fear of the toilet flushing, and there might be fear of the noise, or there might be fear, many toddlers have fears that if you flush the toilet, part of your body goes away, and that's scary. Where does it go? And so we work with kids with social stories, we work with kids with picture schedules. It depends if your child is verbal or not verbal. And remember, children without autism and other developmental disabilities are usually toilet trained by the time they're 3, but they're toilet trained because it means something to please their parents. And so if you have autism and that social impairment, you're not interested in pleasing anybody because that's a social behavior, right? You don't respond to praise because, again, that might be a social behavior that you haven't learned yet. So we have to toilet train in a different way.
So is it about kind of figuring out what the problem is with it, why they don't like going?
Absolutely. Is it sensory? Is it intellectual disability? Is it problems with change? So I often tell parents to always change pull-ups and diapers in the bathroom. Because we need to associate urinating and having bowel movements with the bathroom. And if your child goes to hide behind the couch to have a bowel movement, try and usher them into the bathroom. Close the door, let them have their privacy. but you need to hide in here, not behind the couch, because we have bowel movements in the bathroom. So there are lots of ways, and actually Autism Speaks has a toilet training toolkit. So if you look on family toolkits, if you search Autism Speaks website, there's a toilet training toolkit that you can use.
Oh, that's great. So we have another question. Is it normal for a child with autism to keep baby talking?
So baby talking, I'm assuming, probably means jargoning, which is that Martian talk, rather than babbling, which is that monotonous ba 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 that a 6 to 12-month-old does. So again, it depends. Does the child have intellectual disability, and are they at the level of an 11 to 15-month-old? Or do they have such severe language delay that their language is in that range? So that's possible. Is this the child's early pretend play? And because remember, play is a social and language ability. So are they having early pretend play and having their action figures talk to each other in jargoning? So that's possible. Kids with autism may have idiosyncratic language, so they may have made up their own language, and that's one of the signs and symptoms. So it's possible. Sometimes we need to remind them to use their big boy voice or big girl voice. There are a lot of reasons why a child might be jargoning.
Interesting. So what kind of doctors or providers can treat or diagnose or diagnose autism?
So were we just talking about Arizona?
Sure, let's just talk about Arizona. Let's keep it simple.
Arizona is always an interesting place. Arizona legislates how we do things. So in the state of Arizona, in order to be eligible for DDD, or Division of Developmental Disabilities, our state agency that provides therapies for children and adults with autism, some of the children and adults with autism, you have to be a licensed clinical psychologist, a child psychiatrist, and now you can be a developmental pediatrician
and which is what you are.
Autism, which is what I am.
Yes.
I moved here in 1996. It took me 8 years to get that on the rule books.
Wow.
Even though that's what my training was all about.
Sure.
So it's quite interesting. But we are, in the Governor's Advisory Committee, we recommended to the Governor that they also include neurologists. And that we include, we have specially trained nurse practitioners in developmental pediatrics that have, our nurse practitioners here at Phoenix Children's have all undergone a minimum of 1,000 hours of training with me, which is at least 6 months if you're working 40 hours a week. Have all been trained in the ADOS, the Autism Diagnostic Observation Scale, have all been trained in the STAT, a level 2 screener, and other developmental testing. And currently, they're still not accepted for their diagnosis, though I supervise them, and so I am signing off on them. We are working on other specially trained diagnosticians in the state of Arizona to expand the field so that our patients can have, or the children in Arizona can have access to earlier diagnosis, and that means earlier access to intervention, because we know that the earlier that you intervene with evidence-based therapy, the better outcomes our kids have.
Interesting. And can you talk more about that? You know, why is it that way? Is it because they're still learning when they're so young?
Absolutely. We know that especially the first 5 years of childhood, our brain is actively developing. It's a critical learning time for brain development, not just for, in infancy we're learning movements. So much happens in the brain, and then with regards to language and social skills, and think about self-help skills. Think about that newborn infant who at 3 months of age can't even bring their hands together to hold a breast or hold a bottle, and then all of a sudden by 1 they're walking and starting to talk, and they're able to feed themselves with their fingers, and by the time they're 3 they can go to preschool and they're sharing with friends and making up stories. I mean, it's amazing how much happens in those first 5 years of life especially.
Sure. So what is the average age of diagnosis in Arizona?
So it saddens me to say, because the average age is still 4 years, 7 months.
And what is your ideal age for getting diagnosis?
A child should be diagnosed within a couple months of the parents being concerned.
Mm.
And most parents are concerned before the age of 2.
Mm.
Most parents are concerned by 18, 19 months of age because their child's not talking like other children.
Mm.
But the child who has that regressive form of autism, it's usually around 2 years of age because we see that regression occur between 18 and 24 months of age.
Mm-hmm.
So that child should have access to intervention,
Mm-hmm.
which means you need to have access to diagnosis
Mm-hmm.
by that time. That family should not be waiting 2 years or 2.5 years to finally get a diagnosis.
Sure. So, and that leads me to ask, can you talk about our program, which is called Early Access to Care Arizona? It is a program that trains providers how to treat and diagnose autistic. This is a good example of the
People
language
with
for
autism.
people with autism. Okay.
People first language.
Yes. Can you talk about what the program is and how it helps to treat children?
Yes, it is. Makes my heart so happy to talk about it. So, Early Access to Care Arizona has been something that I've been hoping for and planning for several years. There are other states in the country that have some of the same concerns as I do, and as we all do. And probably about 6 years ago now, I was at a lecture at our Society for Developmental and Behavioral Pediatric meeting and heard Dr. John Doobie, another developmental pediatrician in Ohio, which is where I'm from, talk about Ohio's problem of late diagnosis and what Ohio is doing. And he developed this program training primary care pediatricians in early in regional teams, so that families all over the state of Ohio could have access to a regional team assessment. And I'm so grateful to the Board of Visitors because they decided to fund developmental pediatrics at Phoenix Children's for 2015, 16, and 17.
That's great.
To expand access to care to children with developmental disabilities. And with some of that money, we developed Early Access to Care Arizona. So what we've done is we've developed a 6-month learning collaborative to train primary pediatricians and their team of an early intervention specialist and a school personnel to be able to not just screen for autism, but provide early diagnosis and access to medical home care, so that that child and family could stay in their local community and receive care by their pediatrician. And that meant that the early intervention people, the school people, were trained and equipped with the ADAS, the Autism Diagnostic Observation Scale, which by the way costs $2,000 a kit, along with the training and support to support a diagnosis made by the pediatrician who takes part in this 6-month learning collaborative, which consists of learning modules, monthly reading material, twice monthly webinars, 2 in-person conferences, 2 quality improvement conferences, reliability testing, to support that diagnosis and also to support the pediatrician in medical home care, which means we've also created a telemedicine support network at Phoenix Children's so that the child can actually see via telemedicine if they live outside Maricopa County, the geneticist if they need to, the gastroenterologist, the psychiatrist, the neurologist, the developmental pediatrician, the sleep medicine doctor. So we're really trying to do several things. We're trying to increase access to early diagnosis and early intervention, but also increase access to medical home care, because the literature demonstrates that of all the diseases and disorders that a pediatrician might take care of, autism is the one area where the pediatrician feels the least competent, the least comfortable, and the least confident in providing medical home care.
So we're providing that confidence.
We absolutely, and we our first 2 cohorts have completed their training. Our first cohort, many of them have completed their reliability testing, and they are now providing that medical home care, and our data shows that their confidence, competence, and comfort has significantly improved.
And we will have a list of those providers on our website later today because they are across the state: Flagstaff, Yuma, Tucson.
Lake Havasu, Casa Grande, Maricopa.
So the chances are that you have someone near you who has been trained to treat and diagnose a child with autism.
Including, we have 12 providers outside of Maricopa County and 11 providers in cohort 2 from Maricopa County.
Okay,
and our third cohort is starting tomorrow with their
yes.
first webinar, and there will hopefully be another 20 to 24 people trained, which means when this project is done, we'll hopefully have between 40 and 45 providers who are trained and out there and reliable, and that then, I mean, it's our dream that we can train and support to exponentially increase the number of kids who have access to diagnosis and intervention.
Yes.
The other thing that these regional teams have done is that it's introduced the pediatrician to the early intervention person to the school person, and they're working together.
Sure.
So once that diagnosis is made, that child has a quicker in to intervention. And it's created these local teams. I mean, Casa Grande is a beautiful example. So in our first cohort, there were 3 pediatricians who took part in the training. So they had 3 teams, so 6 AZIP providers, 6 school people. They all meet on a monthly basis and work together on regional resources, and
so it's really equipping those areas.
absolutely.
Yeah, that's wonderful.
We've worked with the State Department of Education and the state level AZIP people who are all very supportive of this, and I really feel like it's just now starting to have an impact. Of course, it takes a while, baby steps to build programs, but I really feel like we're going to improve statewide system of care. And in fact, I'm on the state access quality committee for telemedicine, because our next step, which we're working on getting funding for, is can we provide, and I think we should, but we need money to start it and pilot it, but to be able to provide telehealth coaching to parents from therapists, from board certified behavior analysts and other therapists, to provide parent mediated interventions, especially to those families that are waiting for providers or live in places where there are no providers, to give parents the tools in their home with access to video conferencing, to give those families, okay, how do I work with my child, or how can my caregiver work with my child who has a diagnosis of autism, so that they can get those evidence-based interventions to get better. If we don't have access to therapists in Kingman or Chinley or Douglas.
Sure.
So that's our next steps.
Yeah, we're always doing more. So we have a couple of last questions from viewers. A 4-year-old who is on the spectrum. Sure, being diagnosed early is key, but I run into a wall after wall for services. I have heard over and over that he's too young. Now that he's 4, do agencies want to help?
Well, that's really unfortunate that you've heard that he's too young, and okay, that should not happen. And unfortunately, it's something we are working on at the state level, but unfortunately there's people with wrong information that are communicating to families. I just have to leave it at that because I don't want to get anybody in trouble. But so, depending if your child has access or private insurance makes a difference. If your child has private insurance, does that private insurance cover autism? Under Stevens Law, there are certain private insurances that have to cover autism. Certainly if the child has TRICARE, oh my gosh, that is the best possible scenario, because TRICARE has a phenomenal program to support children and families, children with autism and their families. If the child has access, our Medicaid program in Arizona, the behavioral health agencies are supposed to be able to provide services to children with autism. Some are equipped to, some are not. I know that programs like Touchstone and Devereaux agencies like Touchstone and Devereaux, and I'm sure there are others, and so I'm not saying those are exclusive lists, but they have autism programs, so they can provide ABA type of therapies and other types of therapies to children with autism. If a child is eligible for, if your child has autism, your child should be eligible for DDD. But in order to get therapies through DDD, you have to have All-Tex funding, and All-Tex is Arizona Long-Term Care Services. And in order to get All-Tex, there's certain assessments that have to be done. So I do want to give a shout out to the Autism Society of Greater Phoenix, because they have a great resource to help families with All-Tex eligibility. They also have a great video, phoenixautism.org/autism-101-class.
Okay.
And they have, they have great information in both Autism Society of America Greater Phoenix chapter and Raising Special Kids have parent mentors that can help families get appropriate services.
Great. So we have just one last question. Why are children who are high functioning denied services because they're not disabled enough?
Okay, if I were queen of the world, they would not be.
Sure, of course.
But that goes back to the DDD All-Tex issue. Children are in our state only become eligible for Arizona Long-Term Care Services, which is the funding source for DDD, if they are at risk for institutionalization, which is the old wording, which needs to change because we don't have institutions anymore. I would again reach out to Raising Special Kids and the Autism Society of Arizona, Phoenix chapter, for help with that. However, the schools should be providing services with an IEP under autism. And under Access, the behavioral health should be providing those services if there's difficulty because of the autism. And, depending on your private insurance, getting therapies through that.
Yeah. So we actually have one more question. How effective is ABA therapy?
So ABA, the Applied Behavioral Analysis, actually has the strongest evidence with regards to effectiveness in treating autism. There are many forms of ABA, and a good board-certified behavior analyst should understand all of the different therapies, not just ABA type of therapy, but there's other therapies for autism called Floor Time, GAR, TEACH, Early Start Denver model. So my comment to families is a good therapist, person leading your child's therapy program, should be aware of all of those and incorporate what needs to be done for your individual child. And the whole theory behind ABA is teaching that child a certain behavior, a certain ability, by rewarding that behavior, by analyzing what's preventing the behavior or what's encouraging the negative behavior and then changing that behavior. Because all